I'm Sue. I'm a sexual health nurse and I work as a part of an outreach sexual health team for the NHS in Kent. We've been asked by our commissioners to go into the Appledore Centre, which is a reception centre in Cranbrook. So we were asked to look at sexual health needs, and that was to help support the needs of these young lads, which were sort of 16 to 18-year-olds, probably only been maybe in the country for about 5 days. One of my colleagues had worked with asylum seekers elsewhere in the area, and she found actually that we couldn't just go in and just talk about sex. That wouldn't have been an appropriate thing to do. People hadn't spoken to them about sex in public before, probably wouldn't have accessed that sort of education at school, or maybe even not from their families. And there was an FPA document which looked at supporting sexual health needs of asylum seeker, particularly young males, and also stuff that had gone on in the press to do with them getting into trouble with the police. A lot of it seemed to stem from their misinterpretations, we thought, about sort of social situations. So we actually felt that we had to go in and talk on a much more basic level, and to give them the sort of foundations, the basic sort of stepping stones before we could go and talk about sex and relationships and things. So that was really where we were coming from, even though it wasn't probably anything to do with our role, because normally we go and get people to do chlamydia tests or do blood tests. We assess their sexual health need or their contraceptive need, but actually it was a bit more of a sort of an educational sort of aspect really that we ended up doing. We used a series of drawn and sort of photographic images to facilitate a discussion with the young men, and a lot of it was to sort of challenge their beliefs on it. We weren't saying that their beliefs or what their thoughts were wrong. That wasn't it. That wasn't the intention at all. It was more to try and see things from their point of view, but actually to show them that if they behave in a certain way over here, that would be misinterpreted. Our eyes were really opened from that, and it was very much a two-way sort of learning process, which and I would say the work that we did was it's very much only a very tiny amount of what would need to be done. And as I said, it's not really anything to do with sexual health, although I think we were trying to be responsible, because we didn't want to say, okay, here we're telling you about sex, we're telling you about contraception, there you go, get on with it, because we wanted to put it in context. And I think that is the important thing. It had to be something to base any further information on. So the idea is that other professionals then, wherever they're accessing services, would be able to build on knowledge about sexually transmitted infections, contraception, how to be safe, looking at consent, looking at relationships, healthy relationships. So, almost to follow a whole sex and relationship programme really that you would get in school. We adapted the way we would normally work as well in another way, because usually when we go and work with young people, we don't wear uniforms because we try to get rid of the barrier. It's sort of, for some people it creates a bit of a barrier. But with these young guys, we were a little bit concerned about whether they would actually accept us talking about this sort of information. So we decided to wear our uniform, which we wear at the hospital. It made us seem more professional. It was quite a positive response that we got. They worked in the groups, and we went round and we had a sort of discussion with them. And at the end of the session, one of the lads came up to us and said, "Thank you for talking about this subject," because I think it tends to be a little bit of a taboo subject. So yeah, we were quite pleased with that actually, that he actually came up and said that. We're at a point where we can actually initiate some change and actually help them. That for me is my passion. It's always putting the person first and wanting, it gets me emotional thinking about it, but actually it is putting that person first and doing the best that you can for that person.